Next up on the agenda, we have Samantha Savino, who is also from Canada Health InfoWay, presenting on the shared Pan-Canadian Interoperability Roadmap, progress update and market guidance. So just a brief introduction to Samantha. Samantha is a Senior Manager for Strategy and Program Management at Canada Health InfoWay. Her background is in public health, health policy and project management. Samantha is accountable for the Connected Care program and responsible for the Connected Care strategy development. So thank you so much for joining us today, Samantha. I will pass the floor over to you.
Wonderful. Thanks, Linda. And hi, everyone. I'm pleased to be here. As Linda had mentioned, I'm going to provide an update on our shared Pan-Canadian Interoperability Roadmap. Before I get into the update, I certainly want to give you an overview of what's in the roadmap. Very pleased to hear that at yesterday's presentation with HIE that it was mentioned as well. We do work very closely with them as a key partner in our work. So I'll give you a little bit of a background of what's in the roadmap, where we're at with the roadmap, and then from the market guidance perspective, how we're actually executing against that roadmap through the market guidance document. So with that, we can kick it off. Linda graciously introduced me, so we can skip over this one. So the roadmap, as you can see on the slide here, our shared Pan-Canadian Interoperability Roadmap was launched in May of last year. To Anil's point in his presentation, really articulated the why of interoperability and why interoperability matters. So just to reiterate the importance of interoperability, to focus on improving continuity of care, enhancing collaboration, breaking down data silos, and reducing administrative burden because of that enhanced information sharing. So these are some of the key reasons of why we need interoperability. And by having a shared Pan-Canadian Interoperability Roadmap, it's really a way in which to converge all of the jurisdictions across Canada, so provinces, territories, towards a set of a common goal. And we really do articulate this as a shared roadmap because it was developed in collaboration with all jurisdictions across Canada. And we were it was great that it was actually approved and endorsed at the highest level of government at the Conference of Deputy Ministers back in last May. Within the document, you'll find key strategic objectives, key priority initiatives, and find foundational building blocks that we're working towards collaboratively with all of our partners to really drive interoperability forward. There is the QR code to the link to the document on the screen here, but there's certainly links at the end of the presentation as well, if you want to dive deep into this document. It is a lengthy one, but I'm hoping that today's overview gives you a good foundation of what you can find in there. So really the objectives of the roadmap are threefold. Really, it's to enhance access to health information for all Canadians. It's to increase modernized health system that's built on connected care, and ultimately to support digital innovation by and for all Canadians. So what you'll see on the next slide is really a snapshot of what you can find in the roadmap. So as I had mentioned, there's sort of 4 overarching sections within the roadmap. So we have our strategic goals, which are the common goals that all of the jurisdictions across Canada are aspiring to achieve over 5 years. So it was a 5-year roadmap that was issued. Near-term initiatives. So in order to achieve our collective and interoperability strategic goals, we've identified, again, collaboratively, 4 key initiatives that will help drive immediate progress and value within jurisdictions and across Canada for interoperability and advancing interoperability. We've called out 12 building blocks, and really these are the foundational components that help support all of those initiatives. And what you'll often hear in the description of the roadmap and the way we've approached launching of the roadmap is a top-down and bottom-up approach. So you can think of the building blocks as that bottom-up piece, that these are the foundational components. Working towards advancing these building blocks will ultimately support these near-term initiatives as well as initiatives in the future, because the idea is to standardize these building blocks so that they are reusable regardless of the initiative that's being advanced. On the complementary, the top-down approach is focusing on key initiatives such as the patient summary, where we're advancing a specification and through that work effort, advancing the building blocks at the same time. So really tackling advancing the interoperability roadmap from the overarching specifications as well as those foundational building blocks. The last row that you'll see on this slide here is with respect to interoperability enablement is what we refer to them as. So we fully recognize that the technology is critical for advancing interoperability, but it's not the only thing that matters to ensure that we're advancing interoperability and connected care across the country. So in order to truly advance interoperability, we know that we need, really strong collaboration and engagement. We, of course, need the standardization of data. We just heard a great presentation to that end. Vendor mobilization is a very, very critical component of our work effort to work collaboratively with the vendor market, because ultimately there are partners alongside the jurisdictions who will ultimately implement these specifications and their solutions to drive interoperability and advance connected care in Canada. And change management efforts as another example. So again, recognizing that the technology in and of itself needs to be adopted. So having change management support to ensure that when these specifications are available and ready, how they can then be implemented in a particular either region or solution. So that's really a snapshot of what you can find in the roadmap. And to learn more about the initiatives that we are focusing on, if we go to the next slide, I'll just give you a brief overview of those 4 initiatives that are our immediate priorities that we've, like I said, identified collectively with the jurisdictions. So the first is primary care data portability. And really this initiative is focused or will be focused on developing a primary care data set for interoperable health information exchange. So really the idea behind this initiative is to, in particular, related to EMR to EMR data migration. So something to help clinicians, for example, if they were switching EMRs, how that can be done in a smoother way. Patient summary. You've heard today, Alana is going to do a deeper dive on that in the presentation to follow. But this initiative will allow Care Solutions to contribute pertinent health information into clinical repositories to improve health outcomes and reduce data administration burdens. Patient access to their electronic health data. So this initiative here looks at enriching information that's available to patients and aspiring to enable access to a full longitudinal health record. So Anil mentioned portals. We know that in some jurisdictions, there's lots of portals and different logins and sign-ons, et cetera, for different portals. So how can we streamline that effort from the patient perspective to access their records? And finally, the e-referral and e-consult initiative. So we're working towards establishing a pan-Canadian specification to streamline referrals and consults between interoperable systems. So if we go to the next slide, I want to give you an overview of what InfoWay's service offerings are with respect to the roadmap. So as I've mentioned a few times, the roadmap is really a collaborative effort. It's a shared effort. But I want to highlight where InfoWay plays a critical role. So, of course, we have the key role of the release center, as Anil and Linda kindly gave an overview over. So we offer certain significant subject matter expertise. We offer co-authoring of work products, so such as different resources, specifications, publishing pan-Canadian specifications, and supporting tools to support those work products. As I mentioned earlier as well, we play a big role as a convener and mobilizer of the vendor market. So really working towards bringing together an array of vendor stakeholders to help drive the roadmap forward and align across the jurisdictions, because a lot of times these vendors operate in many jurisdictions. And also in the realm of procurement support. So what we would like and want to certainly advocate for is that as pan-Canadian specifications become available, that these requirements within those specifications are then seen within procurements within jurisdictions. So we're working on developing toolkits that will support procurement services, so that when a jurisdiction is going to RFP, as an example, that they can lean on requirements to gather information that's important for their procurements. In particular, if we go to the next slide, we're focusing right now on 2 of the 4 initiatives that have been mentioned. So focusing now on the progress against the roadmap. A lot of significant and great work has been done in the patient summary, but I'll save that for Alana, as well as the e-referral and e-consult realm. I will mention that we are working very closely with one jurisdiction in particular who is looking to advance patient-mediated access to a health record. So that 3rd pillar is going to light up very, very soon. Going back to the idea of a top-down, bottom-up approach, as I mentioned, we are advancing the specifications in particular of patient summary and e-referral. But what that means is while we're advancing and developing against those specifications, we're also advancing the building blocks that support them. So what you'll see here lit up on the screen are 6 building blocks in particular that are being advanced in support of these specifications, and more to come in the coming years. So you'll see here, for example, building block 1 is HIE's framework that's focused on FHIR. We have consistent data semantics. Reference architecture. So what are those common capabilities that can be leveraged across assets for different specifications? A consistent, secure health information exchange protocol. So we've developed what we call the Canadian FHIR Exchange. You'll hear us refer to that as CAFEX as well. And that's the exchange protocol that supports patient summary. Advancing consistent patient access, as well as from a vendor perspective, conformance. So how we can support compliance and conformance against interoperability specifications. So this is really to help validate capabilities that a vendor may have when they're demonstrating that they are implementing pan-Canadian specifications. So a little bit more detail with respect to where we're at with development against the roadmap. So what you'll see here is a snapshot of the variety of artifacts that are well underway across InfoWay and HIE. You'll see the framework on this as well, because we do collaborate closely with them on that. Many of these specifications are well into development and going to release, either they've already been released or will be releasing shortly. So the patient summary specification, that the initial version of the specification was released last year. So working on iterations to advance that specification. As mentioned, CAFEX, or Pan-Canadian FHIR Exchange. So this specification seeks to promote FHIR RESTful exchange patterns, and it's developed by leading FHIR standards. And that second version of that specification will be available this month. The Pan-Canadian Core FHIR Profile Set. So what that is the FHIR expression of the Pan-Canadian Health Data Content Framework. So again, this speaks really closely to our collaboration with HIE, in that their framework is really the foundation that then the CA Core Plus is built off of. And then finally, we have the Pan-Canadian e-referral e-consult specification. So the first iteration of that specification to, again, help standardize Pan-Canadian e-referral and e-consult will be released this July. So again, links are at the end of the presentation. The presentation will be available, but if you're curious to get into the weeds, learn more about the specifications, what's in them, feel free to take a look and do a deep dive into these specs. I've mentioned a couple of times the importance of vendor mobilization. So this is another significant area for which we've made progress against the roadmap. In particular, we've hosted technical events, which are called projectathons. So these are considered connectivity marathons, but they're focused on a specific project. So for example, a specific connectivity marathon that's focused on patient summary. And what this is an international best practice to help test and leverage interoperability specifications. So this is one way in which we're executing against that building block 9 of industry-wide conformance. And this is, again, an opportunity where vendors can test and demonstrate their capabilities of their implementation of a pan-Canadian interoperability specification. We've also just recently launched what we call the Early Implementer Program. So this is a program that advances shared connected care priority areas that are in the roadmap by supporting leading jurisdictions and vendors with their implementations. So this comes in a variety of support. We offer project management support, we offer subject matter expertise, we offer funding for vendors and jurisdictions to, again, support their implementation. So for those jurisdictions, for example, that are ready and able to implement pan-Canadian interoperability specifications, this is a program that will help advance that and, again, help drive interoperability and connected care across the country. And finally, we've launched an industry collaborative as well. So the first one was hosted in November of this past year. And it's really an avenue for digital health vendor partners to provide insights into federal and provincial stakeholder implementations and to support interoperability initiatives. So it's an opportunity to convene, have important discussions, gather important inputs, and it's really well received. The vendors listed on the left here, there's about 30 vendors that are currently engaged in the industry collaborative. So really great demonstration of working collaboratively to advance the roadmap. So on that note, advancing the roadmap, what I want to turn to is the market guidance. So our market guidance, so this is, you're getting a little bit of a preview for sure, as we are planning to launch the market guidance documentation closer to the end of this month. So it will be public available then. But nonetheless, the purpose of this document is really to provide direction and guidance so that jurisdictional digital strategies, technology stacks, and vendor product roadmaps don't veer in directions that may make pan-Canadian interoperability really challenging or potentially even impossible. So it's really to articulate the trajectory in which the pan-Canadian interoperability is going. So by articulating how we're executing against the roadmap and our key priority areas, it's a way in which to ensure that as folks continue to develop, they're well aware of the direction that the overall country is going from a pan-Canadian perspective, to ensure that there's alignment as we continue to develop. So within it, there are key tenets, so core principles, if you will, that if we truly are bought into the importance of connected care, some of the key things that we need to keep in mind as we collectively develop interoperability specifications to drive forward connected care. And it also, like I said, highlights the core components that we're initially focusing on. This will be iterated periodically. Like I said, the first issue will be released later this month, should be publicly available. So I'll give you a little bit of a teaser of what you will find in there. So the first set of highlight that I want to call out are the key tenets. So like I said, these are key principles, if you will, that if we want to collectively advance and transform digital health system and connected care across the country, these are some core values that we need to work together towards to achieve our goals. So the first one here that's articulated is about thinking big picture. So really what this is about is considering the broader digital health ecosystem through development, rather than focusing solely on an isolated solution or specific environment. So it's keeping in mind like that big picture and what certain decisions mean at a broader scale. The second is aligning with global standards. So in order, for example, partners to compete on a global scale, or to ensure that we're aligned to perhaps best practices, it's important that where it makes sense, we should be aligning to global standards. So for example, our Pan-Canadian patient summary is strongly aligned to the international patient summary. It's also having alignment with global standards is really an opportunity too for vendors coming into the Canadian market. If we're aligned to interoperability standards across the globe, it's ways in which that it makes it easier
Samantha,
yeah.
sorry for cutting in. I
Yeah.
just got this question that I wanted to ask. You said we're trying to align to the international standard. Does that imply the international standard is better, or what is the goal?
It's not necessarily that it's better. We want to ensure that we are how do I frame this? Not that it's better. It's that we want to ensure that we are aligned across. We are aligned ultimately. So it's not that one's better than the other. It's that we are ensuring that we are consistent with international approaches, so that when we think interoperability at the broader scale, the idea is that interoperability in the future, we would be able to share information across borders. So we really need to think interoperability from the broader perspective. So there's certainly rationale for having Canadian adaptations, but it is important to consider when it makes sense to align with international standards that may have been developed. Does that answer your question?
Yes, thank you.
And Sam, we're going to talk a little bit about that as well in the patient summary overview.
Thanks so much, Alana. Any other questions? Okay, and please, others, feel free to jump in or pop questions in the chat as we go along. So for the third tenet that we have articulated here is adopting a growth mindset. So fully recognize that these changes or advancements are not going to happen overnight. It's going to take dedicated time. It's going to take many years. So here it's the value of considering the importance of incremental value and taking steps to achieve our broader goal. And really supporting that idea that it takes one step at a time to achieve this broader goal of connected care. And finally, the last piece with respect to embracing a shared capacity. So again, it's a large goal. So leveraging subject matter expertise from across the country, working together through working groups, for example, collaborative co-development, to really accelerate the advancements of these initiatives to advance the roadmap. All right, so then if we go to the next slide, what you'll see here are the core components that are called out in the market guidance of the key highlights that the key priorities that we're advancing to execute against the roadmap. So the first one is the framework that HIE is leading. So really, this is the foundational exchange of consistent, meaningful data across the health system when it defines standardized concepts, definitions, and value sets. And it really is that underlying data content and data structure to enable the creation of consistent health information exchange data models. So leveraging the framework, as mentioned, also supports the development of our CA core. So the second key core priority or core component is the FHIR-based model. So the health information exchanges across the globe are expected to be heavily based on international HL7 FHIR. So we're driving towards having FHIR-based models to create consistency across all of our interoperability products. And when I say interoperability products, I'm referring to interoperability specifications. In line with that, as well as having common health services architecture. So developing services and assets that can then be leveraged across different specifications. So these are really focused on those building block pieces that can be leveraged for different initiatives. They're not solely specification specific. So something like a service directory, for example, is a key example that we're working on for e-referral work that can then be leveraged by other specifications in the future. As I mentioned, conformance and our projectathons and technical events of really testing core capabilities and ensuring that implementations are executing the way we expect them to as per the specifications. So having a pan-Canadian conformance service ensures that health IT vendor solutions are aligned with industry expectations according to both our national standards, but also global standards. So something like HIE, for example, to your point, JS. And finally, the conformance tied procurements. So this is something that's further down the line, but something that's critical in advancing connected care and interoperability and the roadmap. So once we have the development of specifications, for example, they've been tested in conformance events. The goal is to then have those conformance results be leveraged in procurements where appropriate. So this is to ensure, again, that if a vendor is looking to participate in an RFP, for example, a requirement could be that they've demonstrated conformance at the pan-Canadian level. So this is, again, another implementation strategy to support advancement of the roadmap. So collectively, together, these 5 core components are different pieces in which that if they work together, really advance connected care and interoperability across the country. Now, we're certainly continuing our work on advancing more of the specifications. So, for example, next iterations of the patient summary, next iterations of the e-referral and e-consult specifications, as well as CA core. But we also want to call out here some of the additional initiatives that we're working towards in the coming years to keep an eye on. So the first is the patient access strategy. And really what the objective of the strategy is to create a pragmatic, attainable joint action plan to help reduce burden for patients' access to personal health information. The second, a plug-and-play visual interactive framework. So really the idea behind this initiative is to enable more efficient clinical workflows, reducing administrative burden for healthcare providers, and addressing challenges of digital connectivity. So what it is, it's a way in which to have third-party applications seamlessly be able to plug and play into different authorized clinical applications like EMRs. And finally, the trusted exchange framework. And really what this is a means to establish rules of the road, if you will, for data exchange. So it's anticipated that the work for trusted exchange will focus very locally at a regional basis, but over time evolve to enable full-scale intrajurisdictional data exchange and ultimately interjurisdictional data exchange in an ideal state. So our stakeholders get involved in a variety of different ways. So I'd encourage folks that are interested to take a look and get involved. Recognizing, again, can't do this alone. So what we have started and launched are working groups that help guide the design and development of Pan-Canadian specifications. So there are currently working groups for patient summary and e-referral, as an example, that are present on Info Central. We look to our stakeholders to champion and advocate for Pan-Canadian standardization, and support convergence and alignment to those Pan-Canadian specifications. And finally, looking to our stakeholders to also proactively implement Pan-Canadian specifications and standards to support that better care coordination and connected care across the country. Interesting as well, another item that's hot off the press from a clinical learners perspective is InfoWay will actually be launching a scholarship fund with almost $5,000 available per student for folks looking at and working on innovative solutions to real-world clinical problems that align with InfoWay's strategic goals. So I'd encourage you to keep an eye on our socials. This will be officially launched later this month. Applications will be available the end of summer. So again, super hot off the press. I encourage you to keep your eyes peeled. Is certainly another way to get engaged in our work and supporting contributions and advancing the roadmap and connected care overall. So with that, I'm going to pause and ask if there's any questions.